Many women don't know what the menstrual cycle is and how their bodies work. They don't know what ovulation is, when their fertile days are, or what is normal during menstruation. But it's important to know these details. The answer is yes, as this will help you understand how your body works. You will be able to plan or avoid pregnancy and better understand the physical and emotional changes you experience during each phase of the cycle. You will also be able to notice any irregularities in your body or menstruation, helping you know when to consult your doctor. So if you want to learn more about this topic, stay tuned for the next video. The menstrual cycle consists of a series of physical changes, emotional and hormonal changes that a woman's body experiences each month due to female sex hormones aimed at preparing the body for a possible pregnancy. Normally, this menstrual cycle lasts 28 days, but it can vary between 21 and 35 days. Remember that every body is different and every woman is different, but a normal period is considered to be between 21 and 35 days, with an average of 28. The menstrual cycle begins on the first day of menstrual bleeding, and the cycle ends when another menstrual bleeding occurs, marking the start of a new menstrual cycle. When does the period start? Generally, the first menstruation, or menarche, which is the medical term, occurs between the ages of 12 and 15. Some girls may start earlier, like at 10. Others may develop a bit later, and this represents the first ovulation, which occurs when your body is biologically preparing to become a mother. During this process, your body will experience physical, hormonal, and psychological changes, which will occur month after month until menopause. Menopause occurs when female hormone levels drop and menstruation ceases. This generally happens between the ages of 45 and 55, but that's a topic for another video. To understand the menstrual cycle better, we will split it into 4 phases, with the first phase being menstruation, which corresponds to day 1 of the menstrual cycle and is when bleeding occurs. For several days, the endometrium, which is the inner layer lining the uterus, thickens. This happens in order to create a cushion that allows the implantation of the fertilized egg, thus creating the optimal environment for a pregnancy. If fertilization doesn't happen, our body recognizes that there is no pregnancy, and the endometrium sheds, leading to menstrual bleeding. This bleeding is a mix of vaginal fluid, blood, and endometrial tissue. This period lasts about 5 days, but it can vary between 3 and 7 days. Of course, this will depend on each woman. During this phase, you may feel tense, stressed, and in a bad mood. Losing blood can also make you feel tired and sluggish, and also fatigued. Moreover, the majority of women go through those well-known menstrual cramps, which result from small contractions in the endometrium to facilitate its expulsion. Now we continue to the second phase, the follicular phase. This phase starts on day 1 of menstruation and lasts until ovulation, which occurs around day 14, which indicates that menstruation is included in this phase. In the follicular phase, the pituitary gland sends signals to the ovaries via the FSH hormone to stimulate follicle maturation. It's important to note that our ovaries hold hundreds of thousands of follicles, which are tiny sacs filled with fluid that contain immature eggs. About 20 follicles are usually selected to start maturing, while the rest remain dormant. These developing follicles begin to release estrogen into the bloodstream to notify the endometrium to start thickening again, creating a small cushion and the perfect setting to welcome the fertilized egg if it occurs, enabling a pregnancy to take place. In the cycle, usually, just one follicle matures fully and releases the egg within, while the others stop developing and start to degenerate. During this period, serotonin will be released to help alleviate menstrual pain. This will result in feeling more joyful, more active, wanting to exercise, and ready for nights of passion. Also, during this phase, estrogen levels rise, making you feel prettier, happier, and in a better state of mind. Step 3. Ovulation. Approximately on day 14 of the cycle, ovulation happens due to the increase in luteinizing hormone levels, which causes the dominant follicle to finish maturing, rupture, and release the egg inside. This egg will travel through the fallopian tube, where it will wait for a sperm to fertilize it. If you have a regular menstrual cycle, mark day 14, as this is the most fertile day of your cycle. So if you want to get pregnant, this is the time. But remember that the fertile days are from day 11 to day 16, meaning all these days are close to ovulation. Let me explain why. It turns out that sperm can live up to 72 hours inside you, which means if you have intercourse on day 12 or 13 of your cycle, these sperm can remain inside you, ready and waiting for the egg that will be released, allowing for fertilization to occur. Therefore, if you don't want to get pregnant, refrain from unprotected sex during these days. Fourth phase, luteal phase. This phase starts just after ovulation and lasts 14 days, ending when a new menstrual bleed appears, and this moment will mark the start of another new cycle. The ruptured follicle that released the egg remains as a scar, which we refer to as the corpus luteum or yellow body. This yellow body releases progesterone, a hormone that supports gestation, or in other words, pregnancy. Progesterone stimulates the endometrium to thicken and become spongy, making it receptive for the fertilized egg and allowing the implantation to happen. Progesterone also helps prepare mothers for a possible pregnancy. This is why during these days we might feel some classic premenstrual symptoms, such as breast tenderness from swelling, and we might also feel slightly more bloated due to fluid retention from progesterone. If the egg is not fertilized, then the corpus luteum disappears, and consequently, the production of estrogen and progesterone decreases. This causes the endometrium to begin shedding and detaching, resulting in the return of menstruation. And so, my friends, that's basically the menstrual cycle. But before we end the video, I want to emphasize a few important points. Point 1. If you find yourself needing more than 8 or 10 pads daily during your period, and this repeats every month, then consult your doctor, as this should not be considered normal. Number 2. If you experience very intense menstrual cramps and the pain prevents you from even getting out of bed or doing your daily activities, then consult your doctor, as this may indicate endometriosis, polycystic ovary syndrome, or another illness. Lastly, I recommend keeping a monthly record of your menstruation where you note the start day, how long it lasts, and the amount of menstrual flow you have. In this part, you can write down how many pads or tampons you need each day. Also, write down if you have clots, any unusual odor, or if you have severe cramps. Also, it's important to note if you have any delays or changes in your period. This way, when you visit your doctor, they will have clearer and more precise information about you and your body. In this way, if there is any normality or illness, he will be able to provide a more accurate diagnosis and offer you better treatment. Remember that every body is different, and it's very important to know yourself so that if you detect any abnormality, you can see your doctor. Well, friends, that's all for now. I say goodbye. I love you all a lot. Until next time.